What's up, guys? Doc Danny here with Athletes Potential. Knee pain can be frustrating. We're going to talk about two subcategories people fall into when they have knee pain and show you how you can kind of assess which one you're falling into. We're going to have some follow-on videos that are going to help you realize if you have more mobility restrictions, what you should be doing. If you have more strength and control issues, what you should be doing in that case. So usually what we see is there's either overtension or control issues associated with knee pain. So overtension would be you're very stiff, immobile, and you don't have enough range of motion, so you're creating some essentially bumping up against each other of tissues that's causing some symptoms. If you have a control issue, you're typically more on the flexible side, and you need to really work a lot more on controlling the knee, controlling the hip, controlling the ankle, so that your knee's not moving around the whole time. So here's what we're going to have you do. Two super simple tests you can do for yourself are these. So number one, we're going to have you bring your leg up, and the goal here is to grab down by the ankle and try to fully collapse that calf onto the hamstring. So you should be able to actually get the mid part of your calf onto your hamstring without any pain. If you can do that, then you have enough knee flexion to be able to basically do whatever it is that you want in this stage. If you can't, let's say you're here and you can't get any further than that, well, you probably have an overtension issue in the knee that we would need to address with more mobility movements. So the other one to do is extension. So knee extension. You should be able to straighten your leg out, and your heel should actually come up off the edge of the table. So it actually, what we call hyperextend. This is normal for us to have hyperextension of the knee. Ashley actually has quite a bit. So this is maybe a little bit more than what most people will see. And she would fall into a category of somebody that needs to work more on control and less on mobility. So if you do that and you literally can't get your heel off of the table, then you have what we consider a mobility restriction, meaning we would want to work on the ability for that knee to fully extend. This actually can be a huge problem, especially post-surgery. We'll see a lot of people that have had a surgery or trauma to their knee and they never actually gain back that ability for the knee to fully extend, and it hurts for them to then push off while they're running or jump because they're moving into full knee extension, but they don't really have it. So here are two simple tests you can do. Knee flexion, can you bring that knee up, pull the calf down to where the middle of the calf is touching the hamstring with no pain, and then can you straighten it out, tighten the leg up, and then the heel comes off the table in terms of total knee extension. Those are the two to test out, see how you do with those, which category you fall in, and we'll follow up with some videos to help you with which category you're in.